All right, this is Josh Mandel with a very quick take on access revocation in Smart on FHIR. And so the basic question here is, as a patient, if you are connecting your own health data to an app of your choice, how do we make sure that you know what decisions you've made in the past, that you can see which apps are accessing your record, and that you can make changes? If you want to take access away from an app, how do we make that really easy? And this video is going to be mostly from the perspective of the EHR system that is building the authorization infrastructure. And so as an EHR, how do you make sure that your customers, patients, the end users are well informed? And there's a few things to say here. So first of all, in terms of making patients well informed, one thing is making it easy for them to tell what access they have outstanding and which apps have been connecting to their records. And a key piece of the equation here is having a management page inside of your portal. So if patients go to that management page, they can see a list of which apps are currently connected, and they can make sharing decisions. So I can show you, for example, in my own patient portal from my local healthcare provider, I don't currently have any authorized applications that are connected to my record in the long term. So I've got nothing to revoke, but I also have the opportunity to see which apps have been accessing my record. And I can zoom in here to this third-party apps tab. And I can see, for example, from the demo that I made a video about last week, this Procure app has been accessing my record about a week ago. And these are the different types of data that it accessed in my clinical record: notes, test results, and so forth. So that's one really good practice, is to surface this kind of information inside of your EHR portal in a management page. And then you can put the URL of that management page inside of your server's well-known smart configuration document. That way you can advertise it for outside apps or third parties who are collecting a list of FHIR servers to be able to index it. So it becomes easier to send patients to that management page directly. And as a quick view of what that looks like, inside of the Smart App Launch specification, this is the conformance page that describes how servers can publish their metadata. And this is where we document the management endpoint, which is a URL where the end user can view the applications that currently have access to their data and can make adjustments to those rights. So we had a really good question come in on Zulip about this language. What does it mean to make adjustments to these access rights? This is a question from the Smart stream on chat.phir.org. And the question was, well, should patients be able to do some kind of fine-grained revocation? Like if an app has access to a few different scopes, allergies, immunization, and medications, should a patient be able to come by and just take away the medications scope and leave the other two in place? And the short answer there is no, we don't try to standardize that kind of fine-grained revocation workflow. And the main reason is because authorization happens upon an app's request, but this revocation step can happen totally out of band from the application's perspective, in response to some patient choice that happens outside of the app. So it would be really surprising and potentially confusing or dangerous for an app to think that it has access to these three scopes and then continue making queries with an access token that continue to work, except for some data are not appearing. That would be, a potentially dangerous situation. So our recommendation for revocation is that it be done at the full authorization level. So if I'm going to take back an access decision, that should be loud and clear as a signal to the app, like, hey, my access token stopped working, my refresh token doesn't work anymore, I better begin a new process to reauthorize if that's what the patient wants. So that's a quick take on the granularity of revocation. And then one more point that I wanted to make about proactive ways that EHRs can help a patient be well informed. And this is sort of notifications and reminders. Notifications meaning when an app is first connected to a patient's record, it could be very helpful to notify that patient, maybe through a mobile app notification, maybe through an email, but basically reaching out and saying, hey, by the way, this app is now connected to your record. And that can also be helpful to have ongoing reminders. So maybe once a month or once a quarter, you could have a reminder to a patient saying, by the way, these three apps are connected to your record. And all of these notifications and reminders can link back to this management page so that if a patient sees something surprising in those notifications or reminders, they can easily take action. So that's the basic toolkit that I think about from the perspective of EHRs helping patients to be well informed about connectivity. And from a principal perspective, this is not about limiting patient choice. Individuals can connect the apps that they want to connect. This is all about helping patients stay well informed and keeping their choices aligned with their preferences over time.